Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on herd immunity. Are we there yet? Offered in collaboration with Friends Health Connection. To date, about 5.4 million New Jerseyans have received the COVID-19 vaccine. About 4 million remain unvaccinated. What will it take to get to herd immunity? What are the different types of immunity? Why are vaccines so important in helping achieve herd immunity? We'll get an answer to those questions, as well as an update on the current state of the COVID-19 pandemic today from Dr. Ron Nahass, an infectious disease specialist who is the hospital's chief epidemiologist for Robert Wood Johnson University Hospital, Somerset. We will begin our webinar with a moderated discussion, followed by questions and answers from our audience. Thank you again, Dr. Nahass, for joining us today and for all your continued efforts throughout the past year to educate our community about COVID-19 and how they can protect ourselves, or how we can protect ourselves. I want to congratulate you for being honored this morning by NJBiz for their Healthcare Hero Award in the education category.
Thank you, Serena. Happy to be here.
So let's begin by giving our audience an overview of where we are at this point in the COVID-19 pandemic. Are we in the midst of a fourth wave?
I think that all of us were hoping that this would be the summer of relief, if you will, from COVID, and it turns out not to be the case. So I generally think of this as a fourth wave. The first wave was the one back in March, April of 2020. Second wave was the winter wave that predominantly involved the so-called Alpha variant. The third wave is the wave that I describe as the post-vaccine, post-opening wave, which really was the tail end of the Alpha variant, and that went from around February, March of 2021 to early June of 2021. Had a little bit of a lull, not long enough for any of us. And over the last month, we've entered the Delta wave, if you will, which I think is the fourth wave of our local experience.
So we've heard a lot about the Delta variant. So can you tell us more about this variant and why is it so worrisome?
Sure. So variants are simply a term that we use to describe a change in the virus that's causing COVID. It's the same group of viruses, a coronavirus, but it mutates. It changes a feature of the virus that gives it an advantage. If you think of the virus as a hunter, and the virus is hunting humans, and the goal is to make us sick, every time it mutates, it's really working harder to achieve its goal, which is really to make us sick. And each of the variants that have evolved over this pandemic that I just described in waves has evolved in a way that gave the virus an advantage to make us sick, mostly around what's called transmissibility or infectiousness or contagiousness. So the Delta variant is simply a mutation that has occurred sequentially over the last 18 months that now has made this variant frighteningly transmissible, is the way that I've described it, which gives it an advantage in hunting humans. So it wants to make us sick. It now is way more transmissible. And so from person to person can be passed way more easily. And the best way to understand it, at the beginning of the pandemic, the virus had what's called an R0, the ability to infect other people of about 2 to 3. The Alpha variant had an R0 of about 3, maybe a little bit more, 3.5. The current variant has an R0 of around 8 to 9, and that R0 describes the level of transmissibility. It puts the current variant on the level or the scale of transmissibility very close to the most contagious germs that we experience, the most contagious of which is measles, which has an R0 of about 15.
So just a question. So this variant, is it predominantly affecting the unvaccinated? Is this now that pandemic of the unvaccinated, as we've talked about previously?
Yeah, that's been the sort of the major talking point, because the goal is to get everybody vaccinated because of what you just stated. This is really predominantly a disease or a pandemic of the unvaccinated. In particular, as it relates to those people who are getting very ill and those people who are at risk of succumbing or dying from the variant now circulating. So when we look at it, even this week, this morning, even when I was at the hospital, we were discussing the cases that have been admitted and the cases that have been admitted to the ICU and the individuals at risk of death. And the overwhelming number, well over 90%. In fact, we had 2 people just in the past few days who were under 40 admitted and moved to the ICU because they were unvaccinated. That should not have happened. It's sad for those of us who are working so hard to take care of folks to see that, because that did not have to occur. So indeed, it's a pandemic, an epidemic now in this country of the unvaccinated, particularly as it relates to those who need healthcare. It's not to say that people with vaccine don't get the infection, they do, but at extraordinarily small numbers, number one, but more importantly, when they get infected, they don't get sick to the level that they need hospitalization or at risk of death.
So let's talk about herd immunity. What is herd immunity? Are we there yet? And if not, what will it take for us to get there?
So herd immunity is a term that epidemiologists use to describe the ability of the herd, all of us, to protect each other, even when everyone is not vaccinated. And the reason that protection occurs is because enough people are vaccinated or enough people are immune such that the virus doesn't have the opportunity to move through the population from person to person effectively. Vaccinated or immune people act as a fire break to the virus, doesn't allow it to move quickly. You have to have a certain number, though, vaccinated or immune. And that number is what's called herd immunity. The herd immunity threshold, how many need to be vaccinated, is higher the more contagious the virus is. So I walked you through the R0 values. That's a measure of contagiousness. The higher the R0, the more contagious the virus. The lower the R0, the less contagious the virus. So for example, last year, the R0 for this virus, the variant that was around at that time, was somewhere between 2 and 3. And the herd immunity, it's a mathematical calculation, actually. The herd immunity number was somewhere between 60 and 70%. As I walked you through this just a few minutes ago, I said the R0 was now around 8 to 9. The calculation of that herd immunity threshold then now has moved to 90%. That's huge. That's why it's a challenge at the moment. That's why we're seeing the levels of cases we're seeing now, even in New Jersey, where we've actually gotten a fair number of people vaccinated. It's because the herd immunity threshold has just moved. It's 90%. And so, that just means basically that everybody who's unvaccinated are not going to be protected by all of us who've been vaccinated, simply because the herd immunity threshold's too high. And so the unvaccinated are all going to get infected. That's basically what it's telling us.
So, and just to clarify for the audience, Dr. Nahass, at one point we talked about, oh, well, if X percentage of our population was vaccinated, then we would reach herd immunity. Does that still apply? And if so, what percentage would that be? Sorry, I have multiple questions. And because now you're saying all the unvaccinated are going to get COVID, right? There's a high 90% chance that if you're unvaccinated, you will get COVID. Will they, by getting COVID, reach the herd immunity because they have antibodies in their system?
So the herd immunity threshold has moved to 90%. That means that 90% of the population has to be immune to protect the unvaccinated that are left unvaccinated or the immune compromised. So that's what we mean by herd immunity threshold. Last year, the herd immunity threshold was 60 to 70%. The herd immunity threshold is now 90%. You pointed out in the beginning of the discussion that right now in New Jersey, we're about 65% vaccinated as a population. That means that we are now 25% away from herd immunity. If all of these people that and you can achieve herd immunity by two ways, vaccination or infection. So infection gets you, if you will, towards the goal of herd immunity, because infection does provide some level of immunity. And it's really immunity that we're talking about as it relates to herd immunity. So whether infected or whether vaccinated, the population as a whole has to be 90% protected. We got a ways to go. Now, if all these people that are unvaccinated go and get infected, that'll actually move us towards herd immunity. And there are some on that side of the discussion that, well, that's one way to leave it go and let those folks get infected, and that will contribute to herd immunity. The problem with that is that the mortality rate and the need for healthcare is so high that that's a great risk to the population, and it's a risk we don't need to take. And so that's really the reason why we're emphasizing so strongly the importance of vaccination. And unfortunately, the number we need to get vaccinated now is 90% of the population. That's a huge number. That's a big hurdle.
So, and then I don't know if you've clarified or you mentioned this, but what will it take to get us there?
Everyone's got to get a jab. So if you got, just to do the math, if you've got 9 million people in New Jersey, 90% of them need to get the jab. That means 8.1 million. So we're at, what'd you say, 5,600,000 or 400,000. So you still got another, 3 million people to go. Now, part of the challenge is we don't have approval of the vaccine for the under 12 crowd. And that represents about 1.2 million in New Jersey.
Mm.
So, that is part of the challenge. You need that group because they contribute. We're recognizing more and more that the youth contribute to transmission. Thankfully, the youth, although they can get sick, it's not common at all. But what they can do is contribute to the transmission. And that's a big deal for the people that are older. As I just described, these two individuals that are in their 30s and 40s that are now in the ICU.
So I want to just dovetail on something you said, and correct me if I misquote you, but you had mentioned that, once the unvaccinated get COVID, they will help us towards herd immunity. And I guess that's because of building up those antibodies, right?
Yes.
So let's take a general look at how does the immune system work? If you could give everybody a little bit of background on that.
So our immune system is an amazing part of our bodies, and it has many pieces to it. But the two pieces that are important to understand from the perspective of protection are what's called the antibody immunity. The medical term for that is humoral, so your antibodies, and then the cellular immunity. And some folks, you may have heard about what's called T cells. So those are the two really important parts that we're identifying relative to COVID. So when you get infected or when you get a vaccine, the body's immune system comes to the site of the action. And as a result of that, you mount antibodies and you mount T cells. And both of those help the body get rid of the infection. In that process, the body develops immunologic memory. And immunologic memory is retained for both your antibodies and your T cells. And that memory is available to you as a patient, as a human, should you get exposed to the virus in the future. A week, a month, a year from now, you get re-exposed, that memory then brings the army out again. And it comes out in force because you've developed immunity. And that force now prevents you from getting seriously ill, and it dramatically reduces the risk of transmission of the virus. We see both of those benefits from that immune system memory that we get from being vaccinated or from being sick with COVID. Now, that memory is actually not as strong after natural infection. And that's actually the reason why we're still advising people with natural infection to go ahead and get vaccinated. It's now been demonstrated in a number of different ways that if you get vaccinated after you've been infected, you actually enhance your memory, your immune memory, in a way that allows you to not only more effectively protect yourself from getting very ill, and it also is more effective in preventing transmission should you get exposed to the virus, which is equally important. So for both reasons, you want to enhance your memory, your antibody memory, your T cell memory, by getting a vaccine after you've been infected.
Okay, so when we talk about immunity, there's different types. So what are the different types of immunity?
So I think I kind of covered that, but I'll state it again just for clarity. So there's the antibody immunity, and there's the cellular immunity, and we call that your T cell immunity. Both are important to protect you from getting ill with COVID and to protect against transmitting COVID. So humoral immunity, which is antibodies, and cellular immunity, which are T cells, work together in our immune systems to protect us. And so those are the two principal parts.
Okay, thanks for clarifying. So, and again, just in case, what causes somebody to become immune compromised then?
So immune compromised states are situations in which, whether it be by a disease or a medication, those parts of the immune system I just alluded to, the antibodies and the cellular immune system, or T cells, are reduced to a level that puts you at risk for getting an infection, whichever infection it is. In this case, we're talking about COVID. So we can use some examples that are easy to help understand that. So if someone gets a transplant, kidney transplant, liver transplant, they have to take anti-rejection drugs. Anti-rejection drugs are drugs that suppress the body's immune system. And in doing so, it prevents or limits the body from rejecting the organ, which is good, but it also prevents or limits the body's ability to respond to a vaccine. And it increases the person's risk for getting infections and limits your ability to fight infections. So a transplant patient is a good example where medication has induced an immune compromised state. Different example, someone who has HIV. HIV is a disease caused by a virus. That virus affects the immune system. That's why the term HIV means human immunodeficiency virus. So that disease state affects the body's ability to produce an immune response. And as a result, just like in the transplant patient, those people can get infections more readily and have a more difficult time fighting them. And they may have a decreased ability to respond to the vaccine. Again, they're immune compromised. And there's a lot of diseases like that. So myeloma, leukemia, certain types of cancer, certain connective tissue diseases, lupus or rheumatoid arthritis. So we have lots of diseases that, whether it be by the disease or the treatment provided for those diseases, we have a negative impact on our immune system, and we have to be concerned about those individuals, both from the vaccine response side or the ability to prevent infection.
Okay. Now, you talked a lot about how the body develops immunity. So let's talk about the vaccines and how they work in all this. I know with the community, for those that are unvaccinated, there's a lot of hesitation around the vaccine. So maybe you could talk a little bit about how those vaccines work, how safe they are, and how effective they are. So could you maybe
Sure.
tell us a little bit about that?
Right. So the vaccines are an extraordinary accomplishment and testament to modern medicine and modern science. And frankly, even to the volunteers, I like to always point that out, that agreed to participate in the studies. If you can imagine participating to accept to get a vaccine, but not even know it's a new vaccine for a disease that's life-threatening, and well over 100,000 individuals volunteered to be in placebo-controlled trials. Some got a vaccine, some didn't. That's an extraordinary testament to their willingness to help all of us. But those vaccines, it's now extraordinary. They are extraordinarily safe. There's so little risk relative to the vaccine's ability to protect us from COVID, witnessed over the last year by, frankly, over 200 million people in the US getting a dose of the vaccine and over 2 billion people in the world getting a vaccine. We have almost no modern time comparison of comparing that safety level of those vaccines against the ability of the vaccine to protect. And now we have full FDA approval of one of them, which should provide even further reassurance to folks around the issue of safety. So I think that we've really come an extraordinarily long way towards demonstrating the safety of it. And as I pointed out just a moments ago, we're seeing, those of us that are seeing these folks in the hospital, 95% of the people being admitted to hospital are with COVID are unvaccinated. And that's despite the fact that the majority of the people in the state of New Jersey are vaccinated. So if the virus is hunting humans, it has 5 times as many humans that are vaccinated to hunt as are unvaccinated. Yet the overwhelming majority of people in the hospital are unvaccinated. So it really is an extraordinary accomplishment. And we're not seeing people admitted to the hospital, despite the 5 million that got vaccinated. We don't see anybody getting admitted who've been vaccinated. That just doesn't happen. So really a testament to the power of the vaccine and their safety.
Thank you. So, over the course of the pandemic, we've heard about different variants coming up here and there. So can maybe you speak to how do breakthrough infections occur, and will the vaccines protect individuals against COVID-19?
So no vaccine, polio, measles, tetanus, hepatitis, no vaccine is 100% effective. And the COVID vaccine is no different. It's about, depending on which vaccine, anywhere between 75 to 95% effective in preventing infection. But what the vaccines are even more importantly effective at, nearly universally, is preventing serious illness and death. So even though the vaccines may not 100% protect against infection, they're almost universally, nearly 99% effective at preventing the need for hospitalization and death. And that's true even with the variants that we are watching evolve. So as it relates to the Alpha variant that we experienced in January, February, March, the vaccine was actually pretty effective for both infection and hospitalization. As it relates to the Delta variant, it's really remarkably effective against serious illness. And it's very effective against infection, about 80 to 85% in protecting for infection. But 20% of people who've gotten the vaccine are at risk for potentially getting an infection. That's a breakthrough case. It doesn't mean the vaccine failed. Remember, the purpose of the vaccine is to prevent death and to prevent the need for hospitalization, because that's what we worry about most. I mean, listen, nobody wants to get a cold, but if the vaccine provides enough protection that when COVID-19 affects you after vaccination, all you get is a cold that sort of get you sick for a day or two or three, and then you feel okay, and you're not likely to transmit that to others, that's a pretty good deal, sounds like to me, from what we've experienced over the last year. And that is what we're describing when we think about a breakthrough infection. And so it's not a failure of the vaccine. I don't like the term breakthrough because it sounds almost as though it's a failure. It's not really, because these breakthrough cases, if you will, are not causing death, they're not causing serious illness, and they're not causing hospitalization. And it doesn't mean it failed. No vaccine's 100%. I think that's the point.
Thank you. So in the state of New Jersey, the transmission rate is 1.25, and we like that transmission rate to be under 1. So what precautions should everyone, including those that are vaccinated, be taking during this time when COVID transmission is so high?
So transmission rates are dependent on a number of things. One is, are you vaccinated? That actually has a lot to do with the rate of transmission. Remember, we've already discussed the fact that this is a disease of the unvaccinated. If we had 90% of the population in New Jersey vaccinated, the transmission rate would be under 1. So the most important thing we can do is get everybody vaccinated. Hands down, slam dunk, no questions asked. Now, we don't, because we don't have statewide mandates for vaccination, which is really in contradiction or a distinction between, say, measles vaccine. Everybody in the state's vaccinated for measles, everybody in the state's vaccinated for polio, but we don't have that same luxury for COVID. And so we have a transmission rate over 1 because we have 1.2 million people who aren't vaccinated. So vaccine's the most important thing we can do. Next most important to reduce the risk of transmission are the things we've talked about for the last 18 months, the 4 W's, right? So, wear a mask, watch your space. It's really the space around you. And you really need to be attentive to the space. I sometimes don't always, it almost becomes second nature for me, but when we talk about watching your space, it's not just your distance. How many people is in your space? What kind of space are you in? Are you in an outdoor space or are you in a closed space? What's the ventilation in the space that you're in? So when I talk about watching your space, it includes watching your distance, but it's also about the space that you're in, because certain spaces have greater risk than others. So spaces that are outside have very low risk, period. Spaces that are indoor have more risk. Spaces that are well ventilated have lower risk. Spaces that are poorly ventilated have greater risk. So wear a mask, watch your space, wash your hands. And when you're sick, stay home. Don't infect all of us. I think we always used to get used to the idea, I got a little cold, it doesn't matter. It matters, stay home. And so really, that's really the other things you can do. So the first one, get vaccinated, hands down, slam dunk, right? My new signature, you've seen my new signature. It says, vanquish COVID, vaccinate, vaccinate, vaccinate. That is the first one. Can't get away from that.
Okay, no, thank you. So now we've been hearing a lot in the news about boosters. So, and we talked about that previously in other webinars as well. So will boosters be needed? And if so, why are they going to be needed?
Yeah, it's sort of an interesting question because we don't have full data set yet on what the role of boosters are going to be. However, we've learned a lot. One is the virus is going to mutate to give itself advantage to hunt humans. That's what it wants to do. And what has it done? Each sequential variation that we've seen in the virus has made it more transmissible and incrementally made it better at evading our immune system. So as we vaccinate more people but have not achieved herd immunity and the virus still circulates, it's likely that it will mutate further and develop the ability to avoid our immune surveillance, is the way I describe it. So I do worry that at some point it will mutate enough that although our immunity right now from vaccine is pretty good, it might not be pretty good. And we're seeing some evidence of that in places that have achieved high levels of vaccine, Israel, the UK, and the US, where we're seeing occasional breakthrough cases that are more serious. It's not common, but it happens. And so we worry a little bit about that, in particular, the ability to transmit the virus. So, for example, Israel rolled out a third vaccine dose to a lot of its population. I believe they're at anybody over 40 can get a third dose. And they've given it and just reported on this past week to over 100,000 individuals who got a third dose, and looked at the rate of COVID in those people compared to the rate in people who only had 2 doses. And there was a dramatic improvement in regard to the resistance of the ability of the individuals who've got the third dose as compared to those who got only 2 doses. So some evidence that in fact 3 doses provides a greater level of protection, in particular against the Delta variant, and will move us further along to trying to achieve herd immunity by reducing transmission of the disease. That's the goal. So I do think there's accumulating data that says it. If we want to stay ahead of the virus, remember, the virus wants to hunt humans. It's going to change its coat to infect us more easily. We want to stay ahead. We need to think about things that we can do to stay ahead. And a booster dose is one of those things that we can do to try and stay ahead by enhancing our immunity. And this is not so unprecedented. If you got a hepatitis B vaccine, you got 3 doses. If you got your polio vaccine, you got 3 doses. So, there are a lot of vaccines where that's really a pretty standard approach. And the third dose is sort of this extraordinary effort to get you to have even stronger immunologic memory, something we talked about earlier today.
So now the CDC rolled out with boosters for immunocompromised individuals first, but who qualifies for the boosters, and does everyone need it or just specific select groups?
So they rolled out their first guidance, which was maybe a week and a half ago, that all immunocompromised hosts that we discussed, that group should get a third dose. So that group we already defined a bit. And so all people in that group should get a third dose. It doesn't mean they'll necessarily get a response, but they'll increase their chances of getting a response. What they also said was that they were looking at, and President Biden in his press conference stated that they were expecting that by mid-September, they're going to be offering booster or third doses for all people who are 8 months and later after their second dose. So I fully expect that over the next month, we're going to hear more discussion about guidance from the CDC, from the Advisory Committee on Immunization Practices around taking the third dose. I'm pretty sure it'll probably almost become universal after that point in time.
Okay. So regarding the booster shot, is the booster shot the same dose or potency as maybe your first and in some cases your second COVID vaccine shot? And is the booster shot required regardless of which manufacturer you received initially? So can you maybe talk about how that works with the different manufacturers as well?
At the moment, the booster dosing will be the same dose, same vaccine you received with your first 2 shots of the so-called mRNA vaccines. That's the Pfizer and the Moderna dose. The government, the CDC, hasn't provided guidance yet relative to the Johnson & Johnson single-dose vaccine as it relates to boosting, although most of us fully expect that there will be guidance that says that those who got the single dose of J&J should get a follow-up dose of J&J. One of the questions that is frequently asked about these boosting doses is whether or not it has to be the same vaccine. From a logistic point of view, the government and the FDA is advising that from a science point of view, it probably doesn't matter. Getting a booster dose will be critical, and there's some accumulating evidence that suggests that that'll be perfectly acceptable. But that's not the guidance at the moment.
Okay. So are these boosters going to protect against these new variants, and are there any known or unknown risks involved?
We expect that the boosting dose will create a very vigorous response that will raise the level of antibody and raise the level of T cells and raise the level of memory that we all have to a height that is so overwhelming that it will protect us for the currently known variants. What we don't know is what variants may come to pass over the next 6 months. We've watched these variants evolve quickly. So it is possible that in the next month or 2 or 3, we'll see yet another variant that will not be as well controlled. And so the question that comes up is whether there has to be a change. What you're alluding to is there going to be a change in the vaccine that will, quote, be more effective for the variants? And I know that various companies, Pfizer, Moderna, and others, J&J, are looking at vaccines specific to individual variants, Alpha, Delta. But that doesn't help us for the future because we don't know what the next variant will be. And so we're banking on the boosters actually giving us that tremendous bump in our antibodies and our T cells that is so overwhelming that it protects us against the variants. And there's information in the test tube and in the laboratory that has shown that to be true. But we really don't know what's going to happen in the future as it relates to any changes that might require a different formulation of the vaccine to be even more protective for some new variant. But for now, we'll be well served by the booster for the current variants.
So with all these potential boosters, how often will we need a vaccine or a booster?
I hope the booster is the last one. Maybe we won't need any. So it's hard, right, for all of us, because this is all unknown and none of us can predict what will occur. We just don't know. Will the virus mutate yet again in a way that requires yet another booster, a fourth booster, a fifth booster? We do not know the answer to that. What we do know, how often do we get our flu shots? Every year. Why do we get our flu shots every year? We get our flu shots every year because we need a new variant, if you will, because the flu virus changes each year. And so every year we need to get a booster because the immunity doesn't last long and the virus changes a little bit. And so they change it around to protect us. So might the coronavirus or the COVID virus, if you will, follow that same pattern that we follow with the flu? Maybe. Again, we really don't know the answer to that, but we certainly, again, have precedent that wouldn't be so outlandish, relative to the flu virus and the flu vaccine, that, yeah, maybe it is that we'll need one every year like we do with flu. It really does remain to be seen, though. We just don't know the answer to that, but we certainly have precedent for that regarding the flu.
So now some individuals I'm kind of hearing in the community, they're thinking, well, if I haven't gotten vaccinated before, can I just get the booster and skip the initial 1 or 2 doses? And again, knowing that this requirement, correct, you have to have at least 8 months between your last, they can't just do that, correct?
Yeah, that wouldn't work. And the purpose of the booster is to boost your primary series. So if you think of the vaccination or the process of vaccination as a primary series and a boosting series, in order to get the benefit of that sequence, you must follow the sequence. Otherwise, taking a single dose, for example, the booster, which would end up being a single dose, would not be terribly effective. And in fact, just recently, there was a publication that looked at the effectiveness of a single dose of the Moderna vaccine and the single dose of the Pfizer vaccine. And there was only about 30 to 40% protection. That is inadequate as it relates to Delta. You wouldn't want to take your chances. So if you were going to get vaccinated, you got to follow the sequence, and you should do that because Delta's a scary guy, and you don't want to be, rolling the dice, if you will, you against Delta. That's not a situation you want to be in. So get the sequence, get the primary series, then get the booster. That's the sequence that we want to follow. We may find out, by the way, that the 8-month recommendation is a little bit soft for a bunch of different reasons, some of which are logistics. I wouldn't be surprised if we find out over the next few months that this ends up being something like a day 0, a day 1 month, and a day 6 months. But we'll find out. That 8-month time period is a little bit soft.
Well, I mean, based upon those recommendations right now, where, if somebody qualifies, can they get the booster?
That's pretty accessible, as it turns out. One of the advantages here in the US, and it's one of the controversies, right, is that we've got actually a lot of vaccine in the US, a lot of places to get the vaccine. And there are some, including the World Health Organization, who said we shouldn't be given a booster till the rest of the world is vaccinated. But, that's a sort of a political, social discussion that'll continue. Here in the US, though, we have such a supply, you can get one practically within a week, a couple of days of looking. So whether it be any of the major pharmacy chains, CVS, Walgreens, Rite Aid, Costco, all of them have a lot of vaccine available. A lot of the public health county health officers or county health departments are starting to provide them. And, most of the health systems will provide them. So there's not going to be any challenge in finding booster doses. Get on any one of those websites and you can make your appointments. And there is even a website, I think, at the Department of Health, State Department of Health, that will help you navigate that.
So and thank you, Dr. Nahass. You're absolutely right. So I was kind of a loaded question on my part, but I did plug in the chat. I'm sorry. I did put in the chat for everybody the website for the Somerset County Department of Health. And on their website, there is a listing of opportunities for booster shots in the area. So now we're hearing a lot about, children and the vaccine. So specifically, I wanted to just ask, so with children under 12 are currently not eligible, as you mentioned earlier, to receive the COVID-19 vaccine. As kids prepare to head back to school in a couple weeks, what is your advice for parents to help protect their children and prevent the spread of COVID-19?
I love this question because what's my first answer going to be?
4 W's?
No.
Vaccine.
Make sure everybody who can get a vaccine are vaccinated. You can't get away from the protective benefit of the vaccine. The most important thing is make sure all the 12 and olders are vaccinated. Make sure all the staff is vaccinated. Make sure all the teachers are vaccinated. The administrators are vaccinated. And the family are vaccinated. So the most important thing is everybody that can be vaccinated is vaccinated. In New Jersey, we have 1.2 million people who are eligible for vaccine who are not vaccinated. Get them vaccinated. If we do that, actually our children will be pretty safe because there is less opportunity for the virus to be introduced to the children. And thankfully, although we are seeing more children who are being hospitalized with COVID, and this comes up a lot in my discussions, that's because the virus is so transmissible. And there are still plenty of people around who are acting as reservoirs to transmit the virus. And if you transmit it, some people are going to get sick. Now, in New Jersey and in the United States, nonetheless, when you look at the numbers of children as a rate, that is, for every 1,000 that get infected, how many get really sick? That rate hasn't changed. The number's gone up because the virus is more transmissible. And so it appears, because we hear about it, that the number is bigger. It is, because more are infected, but the rate hasn't changed. And so thankfully, the kids actually don't get that sick all that often. It's just that there are so many more children that are infected because we're passing it around more. And then, as you alluded to, so vaccine works, that's the most important. And then the 4 Ws apply. I think school systems are getting in touch with the idea of ventilation. We've got to keep the school systems ventilated. Keeping stagnant air in these buildings is not good. So watching your space is really critical, and making sure that that space is well ventilated, that the children are spaced out, that, particularly at meal times when there's a greater risk of transmissibility, that we're making sure they're spread out. And frankly, if you could do mealtime outside, that would be even better. So from a space point of view, wearing the masks, very controversial issue, but certainly when they're in the classroom, that'll help. Washing your hands. And if the kids are sick, keep them home. Don't send them to the school with their drippy nose.
So now with fall coming up, what are some other important vaccines or vaccinations that people need? When should they get these? And specifically, if you can also talk about flu, because a lot now coming up with flu clinics, is there a time frame between when people should get flu and boosters? So I know I'm always giving you like multiple questions there.
Right.
Sorry.
Yeah. Well, the reason for some of the confusion around that is it's changed actually. So when the COVID vaccine first came out, we were advised to wait 14 days between other vaccinations because one, we're still in the process of learning, and we were worried about distinguishing side effects from vaccine A to vaccine B. But now we've given this vaccine to hundreds of millions of individuals. We've learned a lot about it. We've discovered that it's extraordinarily safe. And we've also learned that there's really no interactions between this particular vaccine and any other vaccine. And so the guidance as it relates to this vaccine, the COVID vaccine, and timing with other vaccines has gone from having a 14-day window between them to you don't need any window. So you could actually get the flu vaccine and the COVID vaccine together. And actually some of the manufacturers, some of the pharmaceutical companies are looking at putting together the flu vaccine and your COVID vaccine in one shot. So you don't need 2 shots. Right now you need 2 shots. So there is no timing issue as it relates to getting the COVID vaccine. You can feel free to get other vaccines along with it. Some folks will say to me, yeah, but then maybe my side effects will be a little bit worse for both. I actually don't know that to be true, but if you wanted to delay getting, say, for example, your shingles vaccine, or you wanted to delay your flu vaccine for a week just to be sure that you didn't maybe get a greater side effect profile, that'd be okay. I would tell you, you don't need to do that. And if you wanted to do that, I would make sure that you got your COVID vaccine first. Hands down, slam dunk, that disease is deadly, much greater risk to you. Get that vaccine now. Don't wait. But you don't have to wait when you're combining it with other vaccines.
Okay. And last question before I open it up to questions from our audience. So, our primary care physicians typically keep a record of everyone's vaccinations. However, during the COVID pandemic, non-physician providers were offering the COVID-19 vaccine. So what advice can you offer on how somebody can coordinate their vaccinations and get them to be a part of their medical record?
Well, there are a couple of things you can do. There's a bunch of apps that have come out now that allow you to capture your vaccine history that's recorded with the state. So for example, the COVID vaccine is recorded with the State Department of Health on a website that the providers of the vaccine are required to enter your data into. And there's an app, I think the app is called Docket, Docket, like a document, DOCIT. You can download that onto your phone. link it to the New Jersey vaccine site, and then that information becomes on your phone. You can share that information then with your doc, so it's in your medical record. You obviously have your vaccine card that you got when you got your vaccine. I've advised people to take a picture of it. That's what I did, and so that it's always with me as well. And then just make sure that your doctor has a copy of it, so that they have a record of your vaccination as well. So there are apps for your phone. There's the vaccine card. Use your phone and take a picture of your vaccine card. Those are some of the things that I've advised folks to do.
Great, thank you so much. So at this time, I would like to give our audience an opportunity to ask Dr. Nahass some questions. If you have a question for Dr. Nahass, please post it in the question and answer section of our webinar this afternoon. So I'm going to kick it off right away. Great questions. So the first one is, I'm hearing that vaccinated people can still carry and infect others. How does this factor into the herd immunity equation?
Yeah, that's been an important question that we've been looking at over the last several months to try and understand it. And what we know about this situation is that although vaccinated people can get the virus and carry the virus, the transmissibility of the virus from a vaccinated person to another person, whether that other person is vaccinated or not, is much less efficient than transmission from an unvaccinated person to someone else. How do we know that? We know that for several lines of evidence or reasons. One, when someone is vaccinated and gets infected with COVID, they only transmit the virus over a relatively short period of time. Let's use an example, 3 days. I just read a paper today that said 3 days, so 3 days. When you're unvaccinated and you carry the virus, it appears that you can transmit the virus for 7, 10, 12 days, depending on how sick you get. So that's a huge difference in number of days that you're potentially contagious. The second way, we had a second line of evidence. When you look at the infectiousness, the actual amount of virus that you're able to transmit when you're vaccinated versus unvaccinated, it gets a little bit controversial and at times can be difficult to understand. But if you actually culture the virus from a vaccinated person and compare that to an unvaccinated person, it appears that the amount of virus available to be transmitted is less than the person who is unvaccinated. So less transmissible virus, less duration of transmission time-wise. The controversy in this and the reason for some of the questions revolves around the fact that the example that we had in Massachusetts at Provincetown is that they use a tool called a PCR to measure the viral load. The viral loads appear the same. And so people will argue that that means that the transmission is the same, and that's not exactly correct. And the reason is because when you're vaccinated, even though they can measure virus in your phlegm, in your sputum, the amount of virus that's available to cause infection is lower because you've got antibodies and you got T cells, and those cells and that antibody binds to the virus and makes it less contagious and shortens the time period during which it's contagious. And that's what's important to understand and why vaccine is so effective at reducing transmissibility.
Okay. Thank you so much. So what are the differences, and I think you touched on this a little bit, but what are the differences between the Pfizer and Moderna vaccine?
Well, Pfizer and Moderna, there's virtually no difference. They're both mRNA vaccines. They both work in the same way, and they both cause us to become immune from the same antigen. Antigens are what cause our immunity. So there really is basically no difference between those two vaccines. They're very, very similar. The J&J vaccine is distinctly different because that's what's called a viral vector vaccine. And so it delivers the antigen. Antigens are what induce our immunity. It delivers the antigen in a different way than the mRNA vaccines. So Pfizer and Moderna are essentially the same. They're both mRNA vaccines. They both deliver the antigen in the same way. Neither of them are alive. They don't have a full virus. Neither of them will impact our DNA. And their side effect profile and their effectiveness are pretty much the same. So.
Our next question is, does the hospital now require all employees to be vaccinated? I know that one.
Well, the RWJBarnabas health system, along with several other large health systems in the state, have instituted vaccine mandates. There are timelines under which those will be fully implemented, and the RWJBarnabas health system is in the process of fully implementing that mandate. I believe, I don't know, Serena, correct me the date. I think it's October 15th, I think is the kind of drop dead date. You have to be vaccinated by, I think, October 15th, but I'm not.
Right,
100%.
fully vaccinated.
By
Yeah,
October 15th, yeah.
correct. So, okay, so are the booster vaccines targeted toward the new COVID variants? If not, what is the strategy behind taking the booster?
Yeah, so we discussed that a little bit. So let me clarify a bit more. So the boosters that we'll be getting over the next month or two are going to be the same dose of the vaccine that we got earlier. And the idea of that is to raise the level of antibody and to raise the level of the T cells to such a level that the umbrella has gotten bigger. Think of the umbrella. Think of an umbrella, if you will, protecting you from COVID. By taking that third dose, even though it doesn't change the antigen, your umbrella got bigger. You moved from a small pocket umbrella to a big golf umbrella. And that's what the third dose does. It would be nice, almost ideal, if you could craft the vaccine for the variant of concern. But we don't know what the variant of concern is going to be tomorrow. And so in lieu of that, what we're doing is creating a bigger umbrella. And that's really as effective as specifically developing a vaccine directed towards the variant of concern for tomorrow. So we really are just trying to make the umbrella bigger, and that's what the booster dose is doing for us.
Okay. So this is kind of a scenario. So one of our viewers has had an experience. I am terrified to receive my booster shot, having experienced an extreme adverse reaction to my second dose of the Moderna vaccine. The worst was the exacerbation of an existing chronic insomnia, which still has not resolved 5 months later. So is there any possible precautions to minimize this possibility of reoccurring?
So one of the things that we've learned, and I wish I had an easy way to know what will happen to all of us, me included, in getting a booster dose. And will it be worse? Will it be not so bad? We just don't know that. A really interesting and to me reassuring publication just 2 weeks ago looked at the second dose in people who had really serious first reactions. And by really serious, I mean the type that we call anaphylaxis, which are potentially life-threatening. And it took basically 200 of those individuals and actually still gave them the second dose. They volunteered to do this. And most physicians, me included, would probably have hesitated or not advised the second dose because of the severity of the first reaction. And 150 of those individuals took the second dose, and all of them tolerated it. It was extraordinary, actually. So suggesting that the reactogenicity to the first dose didn't necessarily predict the reactogenicity to the second dose. Now, that's not universal. I cite it only as an example about the difficulties in predicting what will happen to us when we take a third dose. Honestly, we just don't know the answers to that. And so if you had bad insomnia, or you had bad body aches, or you got a bad headache, or you felt really bad from a flu-like perspective, Does that mean that your third dose will be just as bad? It does not. And we have no way to know that. What I tell folks is that there's no reason why you cannot take, and in that study, in that publication I just described, they had all those individuals take Benadryl actually at the time they were taking their second dose. There's no reason you can't take Benadryl, and see if that helps reduce the symptoms. There's no reason you can't take Tylenol. And there's also no reason you can't take an anti-inflammatory like Advil or ibuprofen. There's a lot of folks who ask me this all the time. I heard that it reduces the benefit. It doesn't. There's plenty of study that have looked at that. So, use the medications that we use to sort of help us through our flu vaccines or our shingles vaccines or our tetanus shots to help you navigate the side effect risk or side effect profiles for these vaccines. And be reassured that having a reaction to one doesn't mean you're going to have a equal or worse reaction to the third. I just have no way to predict that.
Okay, we have a few more questions if you're okay to hang in there with us.
Couple more minutes and I got to run.
Okay, so if we are vaccinated and using masks, is it safe to travel?
Travel inherently is not unsafe. It's what you do when you travel. So the principle of travel is always remembering it's not the action of traveling that's a problem. It's how you interact with people. And it also depends on your vaccine status. So this person alluded to the fact that they're fully and I'm going to make the assumption they're fully vaccinated and they're not in the group that's immune compromised. So if you're fully vaccinated and not in the group that's immune compromised, you have a pretty low risk generally because you're not going to get very sick should you get COVID. But if you travel and you are, let's just use the example of you're down in Florida or Louisiana, the two hottest states currently in the United States, and you're going from bar to bar and venue to venue, eating and having a great time, which is fine, you're going to put yourself at significant risk just because of repetitive exposures in a high incidence state of acquiring the virus. Now, you're not likely to get sick, but you could transmit it to someone else. If those situations, if that circumstance is okay with you, then they can travel and do that. Nothing is precluding you from doing it. But if you were to travel to Florida, planes generally are actually pretty safe at this point with all the protections they put in, and you wear your mask on the plane. And in Florida, you've rented a private condo and you only eat in that condo and you're going on the beach, you're not going to get COVID from that activity. And so it's really about where you travel and what you do that has an impact, and what your risk tolerance is as it relates to getting COVID. So I don't know, that's the way that I would pose it to someone and thinking it through.
Okay. So earlier you mentioned shingles. What about getting the shingles vaccine during this time? Okay or not okay?
It is okay to get the shingles vaccine. I will say just anecdotally, I thought my reaction to the shingles shot was way worse than my reaction to the COVID vaccine. I just didn't feel good after that vaccine. And it reminds all of us, think about your vaccines and what you got and which ones made you feel bad. I don't think I'd want to get a booster shot for my shingles vaccine, but I'm okay going out and getting a booster for COVID. But it is okay if you get both of them together. There's no reason you couldn't do that.
Okay. So can we get our immunity tested at the hospital? How can we know if we still have immunity?
Well, we don't have a real good test for that. We have a test that measures your antibody levels, but that's not the way we measure immunity. We measure immunity by looking at neutralizing antibody and by T cells. We have no commercially available test to measure your T cells. We can only measure your level of antibody. I will say that if you have no antibody on the blood test, I would have a concern that for reasons that that is a longer answer than we can do on this talk, that I would have a concern that you might not have immunity if you had no measurable antibody. But if you have some antibody I can't tell you the level of immunity you have.
Okay. So one viewer is saying, thanks so much for all this information. With a lot of schools being challenged locally to unmask children, what could you project as the danger of schools in this area challenging the mask mandate and having potentially unmasked students and staff in schools?
Well, it comes back to my first point yet again. I'd rather see the schools mandate vaccine for all those people who can be vaccinated. And if you did that, it might not be terrible to unmask kids. Until you do that, until you have universal vaccination of all those in the school who could be vaccinated, then you're posing a risk to the unvaccinated. And in particular, the unvaccinated that are, say, adults, are the ones that are filling up our hospitals. So that's the challenge that you have to balance during Delta, is that we don't have a vaccine mandate for the adults, which are the ones that are at the greatest risk for getting seriously ill.
Okay. And the last question was that you said that vaccinated people probably won't be hospitalized. Is that true for the elderly and immune compromised?
So when I describe vaccinated individuals, I incorporate in that thought the idea that a vaccinated person developed immunity. So if you are a person who's had a transplant and you're on medicines to avoid rejection of the organ and you got vaccinated, it doesn't necessarily mean you're immune. So you have to be vaccinated and immune to not be at risk from Delta COVID. If you're not immune, you will have risk of needing hospitalization, even though you're vaccinated. And in fact, actually, when we look at the vaccinated people who have been hospitalized, at least 50% of them are compromised in some way, and therefore presumed to not have developed a response to the vaccine, and therefore may not be immune to COVID. That makes sense to me. They're actually acting as a non-vaccinated person, even though they got 2 shots, because they didn't get immunity. So yes, that's a correct statement that people who are elderly and people who are compromised may have been vaccinated, but not have developed immune response, would be at risk for getting ill and needing hospitalization. That's actually one of the reasons for the booster, to try and inch up that number of the elderly and immune compromised who are non-responders and make them responders. And so that's one of the reasons it's important to get those folks boosted.
Okay. Thank you so much. I want to be mindful of our time. I know there was another question. Are you okay, or do you need to jump off?
Last question, and I got to run.
Okay, so this one looks like a 2-part question. Could a second J&J vaccine booster shot cause a response to the adenovirus part of the vaccine, and therefore the body not respond effectively to the spike protein to boost immunity to the COVID vaccine? And then secondly, there's a concern of mRNA being incorporated into the recipient's cells, possibly with reverse transcriptase. Have there been any studies to show, A, if mRNA does appear in a recipient, and if the mRNA does exist in the recipient, that it causes autoimmune disease or other illness?
Well, those are some really great questions. So first, the J&J vaccine with the adenovirus. So viral vectored vaccines, can the body, as a result of that vaccine, develop an antibody to the adenovirus, the viral vector, and prevent response? Well, that was certainly a theoretical concern that's not been seen. So we don't have a particular concern about that. As it relates to the question around mRNA being incorporated to the body because of reverse transcriptase, theoretically that could happen, but it can't, because the human body doesn't have reverse transcriptase. And we do not give with the vaccine reverse transcriptase. So very sophisticated question, but it's impossible actually, because humans don't make reverse transcriptase, so there's no way to transcribe change the RNA into DNA, which would then be incorporated into the body. And the vaccine itself is not a virus vaccine, it's a subunit vaccine. So it doesn't incorporate reverse transcriptase, nor does it incorporate the instructions for reverse transcriptase. So there's no way that that could happen. And the vaccine itself, or the RNA, the mRNA strand that's used for the vaccine, has a half-life in humans, meaning it only lasts in our bodies, for hours. It's a really short time period. And so therefore, there's really just almost, it's just an impossible event. Can't happen.
Wow. Well, Dr. Nahass, thank you so much. This has been great information. Really appreciate your time today. So this will actually conclude today's webinar. Again, thank you, Dr. Nahass, for answering all these questions and for providing us with invaluable guidance on navigating our way through the COVID-19 pandemic. Thank you all to our audience for joining us. Please remember that the information provided here today by our medical expert is not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral service at 1-888-724-7123. For more information about COVID-19 and the COVID-19 vaccine or other upcoming webinars, please visit www.rwjbh.org/Somerset. Thank you all and be safe out there. Have a great afternoon.
Thanks. Bye-bye.
Bye-bye.